Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. Welcome back to the Hope Natural Health podcast, where I try to get you healthy the right way. Last week, we talked all about birth control. So if you are on the pill, I highly recommend that you go back and listen to this episode. But this week, we're going to be talking about poop and why poop matters. It's really not the sexiest topic to talk about, but it's honestly so important for your health. I almost think that it probably should be considered the sixth vital sign in addition to your period as the fifth, in addition to your blood pressure and your heart rate and all of that, because poop is so important. Your gut is a healthy garbage disposal, ridding the body of what it needs. So if you aren't pooping once a day minimum, this means your garbage disposal needs repair. There is this nifty little chart, and it's called the Bristol Stool Scale. So you can Google this, click on images, and you can find it. But I'm going to run through what the 7 types of poop are. So they're labeled from type 1 to type 7. And in here, we can talk about what these signs and symptoms mean. So type 1 is you might have these really tiny little rabbit turds, is what I like to call them, or separate hard lumps. They look like little nuts. These are usually difficult to pass, and they can be painful and even black in color. This is usually a sign that you are constipated. Type 2 is more sausage-shaped, but it's still really lumpy. This is also a sign that you are constipated. Type 3, 4 are most common and the most normal types of stool. Type 3 is like a sausage, but it has some cracks on its surface. It might be a different color, but this is considered normal. And then type 4 is also like a sausage or a snake, smooth and soft. This is literally the best, perfect type of stool, and this is considered normal. Type 5, 6, and 7 are more indicative of diarrhea. So 5 would have like soft blobs with clear-cut edges. Type 6 is like fluffy little pieces with ragged edges, very, very mushy. And then type 7 is straight water. You have no solid pieces. It's entirely liquid. So if you have zero clue what your poop looks like, I challenge you now to start looking at it because it's so important. It literally is telling you what's going on inside your body with your digestive system and what you're getting rid of. Remember, it's your garbage disposal. Things need to come out, and it comes out through your poo. And if your poo is not healthy, you are not healthy. There's also, you might notice different colors of your stool. So we'll go through some of the colors that might be concerning and some that are normal. So green poop means you likely might have digested your food too fast, which sometimes usually isn't a reason for concern. So if you're continuously having green poo, make sure you are chewing your food, eating slowly, and possibly taking some digestive enzymes to help with your digestive system and digesting it slower. Yellow poop means that your gut is having trouble with fats. This is typical for someone that has perhaps celiac disease, perhaps no gallbladder, or they have malabsorption issues, which I focus a whole ton on gut health in practice. So this is why I talk about poop, because it's so important for your overall health. Black poo, this is actually something that might happen if you're taking iron, or it could indicate that we might have internal bleeding. So make sure you pay attention to black poo. White poop really is not good. So if you're seeing white poop, this usually suggests that you might have some sort of bile duct obstruction. So I would see your physician as soon as possible because this is probably not a good sign. Red poo, this could mean a multitude of things. If you've had a lot of berries, perhaps like a really bright red beet juice, or even eating beets, this is probably the cause. So don't panic. But also, if you're not eating any of those things, it usually also can indicate the presence of blood and it might be an indicator of something serious. So seek medical help if you see this red poo. Floating poop is another one that's not really considered in the stool chart, but if your poop tends to float, it just means that there might be some trapped gas in your stool. So this can happen occasionally, but also if you have continuous floating poop, it means that you're probably not absorbing fats and oils. You might not have a gallbladder if this is the case, and digestive enzymes are super important for that. So to recap, some red flags is we don't want blood in the stool. So if you see blood in the stool, not a good sign. Consistently difficult to pass or pain when you pass your stool, not a good sign. If you have ongoing diarrhea, not a good sign. So what do? There's a couple tips and tricks that I can point out to help with better stool. And my favorite is using digestive enzymes and probiotics, but honestly, these are not indicated for everyone. So I would definitely speak with your physician first, because not everyone needs probiotics. It might actually exacerbate or worsen your gut symptoms. But digestive enzymes are usually helpful at providing your body with the enzymes needed to properly digest your food. Hydration is probably maybe number one outside of the supplements that you can take. But if we're not hydrated, you're going to be tending towards the type 1 and 2 of the constipation, because we don't have lubrication to really pass anything. We're just stuck and dry and therefore constipated. You can work on increasing fiber. My favorite forms of fiber are beans, tons of vegetables, and berries and fruits are good sources of fiber to make sure that we get plenty in the diet. I know I've talked about fiber a lot, but most people are only getting about 10 to 15 grams of fiber a day. We need upwards of 25 to 30, and I guarantee that will help increase and improve your bowel movements. Obviously, decreasing stress. I know if you're nervous or nervous Nancy, you might have looser stools. It's typically normal for anxiety, or sometimes you don't poop, like vacation constipation. A lot of people don't poop when they're on vacation, but stress plays a giant role in your bowel movement. So making sure you find time for you to combat your stress. And then you can always consider food sensitivity testing to see if there's any foods that you're eating on a daily basis that might be contributing to differences in your stools. So again, if you're not pooping one day a minimum, this is a sign that your garbage disposal needs to be looked at, and that is your bowel system and your poop. I hope this was valuable. I know, again, it's not the sexiest of topics, but it's very, very important. So I had to share it because poop I talk about daily in my practice, and I make sure I know everyone's poop and what's going on with them because, like I said, it's so important. Again, if you found value in this, please share it, and I'd love to hear your comments on it, and we'll see you again next week.